Let's cross over to Eldoret, where John Wanyama is standing by, still with the same situation, still same story about the World Cancer Day. And Wanyama, what is it like in Eldoret as we mark this day?
Thank you, Sam. In Uasin Gishu County, the situation is worsening each and every day because of this menace. And yesterday, Uasin Gishu County celebrated this particular day yesterday. And the reason they gave is that most of patients were around yesterday, and those cancer survivors were also around yesterday. So they decided to celebrate their day yesterday. And Sam, the issues that came up from that function are really shocking. That in this country, Sam, you can only be screened for only 4 types of cancer in this particular country. So the doctors in this particular field are urging the government maybe to speed up this particular fight against cancer. And also another thing, Sam, is that in Uasin Gishu or Rift Valley, Nyanza and the entire western region, they don't have even a single radiotherapy machine. This is now a blow to a fight against this particular disease. In Eldoret, here in Moi Teaching Referral Hospital, being the second largest hospital in the country, Sam, you understand that a donor came and gave the hospital money, which built a big hospital, put up banks for radiotherapy machines. A hospital is complete, but nothing. The government is not really committed to buy that particular radiotherapy machine that could have really helped most of Kenyans from this particular side who are forced now to move and go to Nairobi to seek for these particular important services from Kenyatta Hospital. I'm joined with Dr. Kipchumba Meli, an oncology doctor here in Eldoret. Daktari, as we celebrated this day today, what is your take on this particular disease?
Thank you, Mr. Wanyama, and thank you, citizen, for highlighting this plight of cancer in this country. Cancer is a real challenge. The cancer burden in this country is increasing on a daily basis, and we do understand that a lot has changed since earlier years when the diagnosis was not as much as right now, and it's because of many reasons. One being, the risk factors have increased since then, and there is a lot that have been discovered through research that has enabled us to diagnose these diseases quite early and more often. And there's also improvement in technologies towards diagnosis, cutting across the different parts of the country. So the suspicion that we had initially using archaic or minimal diagnostic tools has increased because counties and hospitals in general have managed to purchase newer equipments which have newer technologies, and we are able to diagnose these diseases much early. And training also into this field where we have more doctors who are trained in taking care of cancer at multidisciplinary level. When you are taking care of a patient or when walking a journey towards diagnosing cancer, it is not only a cancer specialist who participate here. Okay. We need an entire team, from sensitizing, people who work at primary health care, clinical officers, nurses, physicians, general practitioners, and even those who are involved in making diagnostic investigations, like doctors who do radiology work and doctors who do pathology work.
Okay, Doctor, maybe I'm being told we don't have time. I wind up. What type of this cancer that is really killing most of people in Uasin Gishu County? And we have been also told that there are some particular materials that were used to build houses earlier before that are now becoming risk to Kenyans' health.
So risk factors for cancer, we have highlighted lately that asbestos is a big risk factor for lung cancer, and we are seeing a lot of lung cancer on the rise lately, which it has made us to wonder what could be the possible risk factors. And asbestos has been documented all over in the world, and in other countries this particular material has been banned completely. And this material was used to lace building materials earlier on in the early 90s, and in our country there are still some houses which still have those materials. They were also used in lacing some water pipes, and if we use water, if we live in these houses which have asbestos, we could inhale, and if we inhale, it becomes a risk factor to lung cancer, and it's been really great. cancers that kill most Kenyans, as data in Globagon 2019 reflects, we are still having breast cancer as the leading cancer. We have cervical cancer in women coming very closely, and cervical cancer kills more women than any other cancer in this country. We have prostate cancer in men still being the leading cancer, but we have other cancers which are on the rise lately. Cancer of the esophagus, cancer of the stomach, and cancer of the colon. These have really increased.
Okay.
Yes.
Thank you, Doctor. We will have some more time to talk to you in our subsequent bulletin. Now, Sam, as you have heard from the doctor here, the issue that also is arising here in Uasin Gishu is that, Sam, you remember the government gave county governments particular machines to just to help in fight against this particular disease. But in Uasin Gishu County, despite the fact that Kenyans here in Uasin Gishu are paying for that particular machine 200 million Kenyan money per month, that machine has never been seen in this particular county. A question that Kenyans are asking: why are we paying for these machines that we don't know where it is? And they are asking, when will it be in this particular county, as they continue to work and sweat as they pay for this particular machine. We are still following up on this story, Sam. We'll come back to you to inform our viewers wherever they are in our subsequent bulletin as what has unfolded from this end. Back to you, Sam.